posture and education for the prevention or management of back pain in pregnancy. So what can we do to manage our different types of back pains? Well, the first would be adopting good postural habits, which I understand is much easier said than done. I will elaborate more in the next few slides. Avoiding high heels. Keep them to less than 1 inch, and platforms are better than pointed heels as they too can change your already shifted center of gravity, making it easier to lose your balance. Use a heat pack or a hot water bottle or even a warm bath. Heat relaxes the muscles, can be pain relieving. Remember though, never to place a heat pack or a hot water bottle directly onto the skin. Always wrap it in a few layers of a towel and also never place it on your tummy. Keep it on your back. You may leave it on for approximately 20 minutes. General exercises such as pelvic tilts can be very helpful for those with tight muscles, but also can help to strengthen those with weakened abdominal muscles. So let's go back to our postural habits. Have a look at these 2 photos. Look familiar? In the photo on the right, we see what we call a poking chin. Over time, this can lead to added mechanical stress to the neck and upper back region. We see that her shoulders are also fairly rounded. This can also reduce her ability to take deeper breaths, or may cause her even getting short of breath as the lungs have less room to expand. The photo on the left depicts a fairly common posture we see if perhaps I'm waiting in a longer queue. She takes more weight on the left leg, thereby putting more strain on the muscles of that side of the body. So what would good standing posture look like? We would have our head pulled up and sitting above our shoulders. Drop your shoulders and pull them slightly back at the shoulder blades. Lift your chest and your ribs. Keep your back upright. Tighten your stomach muscles. Tuck your bum in. Bend your knees slightly. Stand with your feet hip width apart. Now let's have a look at the 2 photos in sitting. With the lower back unsupported and the weight of the baby, this compresses the lower back, and over time this would lead to back pain. Also, having slid forwards on the chair, the thighs are also unsupported, thus making it unsafe, easier to slide off the chair. On the left, that poking chin is still visible. Shoulders are rounded, and the feet are off the ground and not resting. And depending on your lordosis, without any back support, this can become uncomfortable and achy. So let's see what good sitting posture would look like. An ideal chair is one with good back support for your back, holding the back upright. It should allow support for your thighs, allow your knees to relax at right angles, your feet to rest flat on the floor. You can use a back roll or a small cushion at your lower back, which will help to maintain the natural curve of the lower back when sitting down. The way we bend to lift and pick things up can also affect us. Imagine picking up your laundry basket or reaching for that shopping bag on the floor. Common errors are, for example, the photo on the right, keeping the object too far away from us, especially if it is heavy. Or in the photo on the left, though there is more effort here to bend the knees and keep the object closer, the rounding of the back can lead to unwanted added mechanical stress to the lower back. So how would we pick up something from the floor? What's a good lifting technique? You would want to start by pulling your tummy muscles in. So imagine you draw your belly button in towards your spine. Tuck your buttocks in, tighten your pelvic floor muscles, and keep your spine straight. Step into a half kneel position and bring the weight close to your body. This is especially important if what you're picking up is heavy. Using strong thighs instead of your smaller back muscles and ligaments, push through your legs and stand up. How about when we carry things? In the photo, we see that to compensate for the heavy bags on the left, she bends and leans her body towards the right, putting a stretch on the muscles on the left and compressing those on the right. How should we carry? We would want to distribute your load evenly, decrease the load through several trips, or get someone to help you if you can, or use a backpack type of handbag, and this would help redistribute the load evenly. Should you have any burning questions about taking care of yourself during pregnancy and after delivery, please email your questions to pec@kkh.com.sg and we'll be happy to answer your questions. Thank you.